In this video, we're going to talk about what the meal and break periods are. So the Fair Labor Standards Act does not have or require lunch breaks or coffee breaks. It's something you need to keep in mind that some states may require this, but not federal law. So again, talking in terms of federal, but if your state requires it, you need to keep up with that. Now, the federal law talks about breaks and in terms of compensability. When I say compensability, it means do you have to pay for it or not? So breaks that are lasting about 5 to 20 minutes are considered compensable, meaning that if the person takes that much time and they're not doing any work of any type and they're on a break, whether it be coffee break or walking around and talking to staff members or using the bathroom, those are considered compensable. Now, I love how they say this, but it's called a bona fide meal period. When I hear that, I just think this person's not doing any work. And that's the kicker. They're not doing any work at all, meaning they're not doing chart notes. They're not documenting per visit information. They're not going through the point of care and doing any type of records or charting or, planning or talking to people on the phone about work or doing work of any type. So when no work is done and lasting at least 30 minutes, this time is not considered compensable. So at least 30 minutes. So here's an example. Sam takes a bathroom break and gets coffee for about 22 minutes. Is this time considered compensable? Well, hopefully after just looking at the last two rules, you answered yes. This time is less than 30 minutes of non-work time, and it's still considered compensable in this case. Well, what if Anthony leaves work and then goes to lunch for 1 hour and 15 minutes? So he's gone for an hour and 15 minutes. Is this time considered compensable? As long as he's not engaged in any sort of work activity, he's not due any sort of compensation for this time that he's on lunch because Anthony's doing no work and his meal period is at least 30 minutes. So the time is not compensable. So you're safe. Remember this. This is the most important thing. And I've read this multiple times, not just with home health, but any industry. And it's so easy to have this happen. If you're asking your home health care staff to document and chart during lunch, or even make phone calls regarding work, or do anything that's work related during their lunch period, that time is still considered compensable as they are physically working. Again, they call it suffering in the Fair Labor Standards Act. When they say suffering, that means a person's suffering work. That means they're not on their own time. They're doing something for you. If they're doing something for you, that means the time is compensable. If they're not doing something for you and they're on their own time, reading a book, looking on their phone, talking to somebody, or using their time away from the facility, that means it's not compensable. Now, this is a subject that comes up, but it's been more in healthcare than it is in home health. As a matter of fact, I didn't see any reported incidents with this, but I'm covering it in case you want to do it. Auto lunch breaks are where you deduct a certain amount of time from an employee's time card for lunch. Example, I've seen hospitals deduct 30 minutes or an hour from this person or clinician. And again, that is something called auto lunch breaks. But let me just put it to you like this. I do not personally recommend this unless you have a very strict policy, everyone signs off on it, and a very strict reporting policy that employees tell their managers and payroll if they work through their lunch. In other words, you must pay for every minute the employee works. So if you do auto lunches, ensure you have a very tight process around it.